Um, I'm Geoffrey Lauer. I'm from Iowa. I serve as the executive director of the Brain Injury Alliance of Iowa. Been in that role for more than 15, probably close to 17 years. Before that, I worked with the Brain Injury Alliance, Brain Injury Association, Brain Injury Association of America, first as a regional director, and then as the national director for state affairs. And so I've had the great good fortune of having worked in and with state leaders across the country for years and years. And that's frankly where that's where our best work happens in this country. The states are, as they always have been, the test areas for trying new services and supports. And then even as recently as yesterday, I was working with a colleague from North Dakota who was interested in translating some of our legislative rationales into North Dakotese. I didn't even know there was a concept. So that said, again, Geoff Lauer here, and I'll be your host today as we walk through 2020 year in review. It's one thing to tell you what we did. It's another to tell you how we did it. It's even more important for us to get feedback from you about where you think we were on track. And then frankly, and kudos if you want to give them to us. Our egos are dynamic enough to withstand no kudos, but it's always helpful to tell a committee chair that there are people who are grateful for a certain component. But then really the constructive criticism. And the constructive criticism, we're not going to take the time to do on this webinar, but I'm going to talk about how over the next year, we intend, it is our commitment to get constructive feedback, whether that be criticism or guidance from each of you, as well as constituents in your state. So now that I've taken a minute to get folks who might be able to get on, we'll start. Carrie, just because you're going to be on deck with me first, if you could go ahead, thank you for unmuting. I'd like to introduce Carrie Collins-Fidel from Brain Injury Alliance of Arizona. Fun fact, when some of us who were founders of USBIA, and I'm now in the OF category, which is known as old farts. I'm one of the old farts who, with colleagues from New Jersey and Minnesota and Connecticut and Colorado and Utah, came to the realization that the missions that we had and that the focuses that we had really demanded something different for us. And we founded USBIA in Arizona with the support of BIA Arizona and their state agency. And we had a strategic planning session in Carrie's offices. I don't think Carrie was there at the time. I don't know where you were, Carrie, but I'm glad you're there now.
I was in New York.
Oh, thank you. You were in New York. It was before she showed up. The point being is that we had this very gracious support from Arizona to powwow for a number of days and think about what we could do that provided the very essential and core supports to our state organizations so that we had a national structure. And that's where USBIA was created. And our mission is at the top of the document. The mission of USBIA is to engage the community in both preventing brain injury and improving lives. There is this piece of improving lives that always catches me. I've worked with people with brain injury for now 30 years. I'm the father of a daughter with a brain injury. And for anybody on the phone who's an individual with a brain injury, I do want to say that people's lives are perfectly fine wherever they're at. I mean, truly, many people with brain injury are doing great. And just like anybody without brain injury, they want to do better sometimes. And so I don't want that focus of that issue of improving lives to suggest at all that the lives of people with brain injury are bad, are broken, are not just as they could be. I think it's really important to say that all of us probably do better when we're trying to find ways to improve our lives and then the lives of the people we love and live with. So that said, public policy over the last year is either an area that for you is dry as salty bones, in the desert, or you might be a wonk. And either way, or in the middle, we're going to try to thread that so that you can see that under Carrie's leadership as the chair and her co-chair, Tom, who I think is here. Tom, are you, can you unmute? Are you here, Tom?
I am here. Yep.
Right. Thank you. Introducing Tom Grady from Brain Injury Alliance of New Jersey, who's been just a trooper and an anchor in public policy. He's the director of public policy. That might not be your exact title, Tom, but it's close enough for me in New Jersey. New Jersey happens to be a long-standing, dynamic, and one of the largest of our alliance states. And Congressman Pascrell from New Jersey has been a champion for brain injury across the country. And Tom's done a great deal of care and feeding for Congressman Pascrell's staff around information about brain injury in their own home state of New Jersey, but also then integrated vertically so that it can affect rural Idaho, rural Iowa, or rural Ohio. Those are the three states. So I'll use those just as a tip. Hey, in 2020, our public policy committee was really functionally, compared to years before, they were on fire. They brought a number of speakers to the committee to better orient and learn about what the range of possibilities were. Carrie, do you want to just touch base on what some of those were?
Yeah, we started by engaging the Congressional Brain Injury Task Force staff to learn what their policies and what their interests were for the direction of the committee. We also looked as a committee at things like improving disability access to voting in really several niche policy areas, like those pharmaceutical rebates and different things that really directly affect access to medical care for our constituents. And our hope was to not only, take that information as a committee, but then the next year be able to start offering more as far as information, webinars, and things to the entire United States Brain Injury Alliance community.
Thank you. Thank you. And it's been effective. One of the things that I see as chair is that the phone calls that I get from our collaborators that are from federal agencies, from ACL to CDC, NIH to the TBI model systems, are aware that we have now stepped up and engaged the Congressional Brain Injury Task Force as at the least a national organization that has a mission for and is interested. And frankly, you guys have taken it a step forward because they discern that there are people that are working together to pool best practices and think about this area a lot. We have been and we are turned to with more visibility, with more capacity in public policy, and frankly, with more clout. And so, Tom, you and Carrie have moved in this last year. I sense it, I see it, USBIA up the chain in both visibility, capacity, and clout. And so thank you for doing that. I also have to recognize the other members of our committee, Molly Clark, Alina Fong, Janice Meagle, who happens to be my board chair and boss. She's okay. Jeff Nakbar from Minnesota. He's the public policy director there. Alina happens to be from Utah, and her partner in Utah, partner in brain injury, Michelle Sugarman L, has been on the committee for a couple of years. And so I'm not going to lie. It takes a little while for a group like our public policy committee, when it pulled together, to go through 4 key stages of organizational development. One of the few things I went to school with, or in grad school, was in interpersonal communications and group dynamics. And they say that when groups come together, they form, they norm, they storm, and they perform. And this group has gone through forming, figuring out their shared norms, arguing back and forth a little bit about what's first and what's second, what are we going to do? And now they've got their fuel tank full and they're moving. So they're in a place of performing. So I look for better things coming post-pandemic, in the pandemic, from the pandemic. We'll touch base on some of those components in a little bit. Thank you, Carrie. Thank you, Tom.
And Geoffrey, I just want to mention too, as with most things, the Day on the Hill in March is going to be virtual. So please watch out for information, because we're going to be able to help people engage like never before for the March Brain Injury Day on the Hill, which was usually in person in Washington, D.C. So we'll be participating as a group with some of the planned activities, and also doing some of our own USBIA outreach to our members of Congress.
And so thank you, Carrie, because that prompts me to remember to speak forward to people who are not on this call live. If you're looking and watching this video asynchronously, as they say, at some later time than today live with us, please know that we have the interest in having you become engaged and asking, either if you have staff and executive director, or if you want to call me or any of our executive committee, or email us at usbia.org. There is an opportunity for people in your state to make a significant impact this year around legislation. There is, as you know, an administrative change that for some of us is call for arming up and getting on the road. And for others of us is a deep relief. And wherever you are, I bow in honor to you that you're a democratic, passionate person for being in the brain injury community. And you also understand the impact that DC has on people with brain injury nationwide. The two components I'll throw in here is that the Biden administration we've already communicated with them as a collaborative with NASHA and a range of other national organizations to let them know what's standing as undone in brain injury and where the big rocks are. One of the emerging rocks is the impact of this pandemic. COVID-19 has very strong medical evidence from the Journal of the American Medical Association, through the Lancet from England, through international journals, that it leaves some people, unclear how many, with enduring brain injury. That's the simplest way to say it. We don't know how enduring. Medical professionals believe they know why and how this happens. We're not able to look at it yet from a brain injury rehab or support or long-term care perspective, because as a country, we're still trying to get the vaccines out the door. So this is still crisis acute care mode. But over the next months and years, we will have millions of people, millions of additional people who are experiencing brain injury from COVID. That's a challenge, because there is not a system in place yet that will address that systematically. There will be, or there should be, and our mission and your efforts will inform that. All right, Peggy Reicher, are you on deck?
I am. I just hopped on because I had another meeting that ran a little late.
Well, that's you, Peggy Reicher, Executive Director, Brain Injury Alliance of Nebraska. Iowa's neighbor to the west. She keeps track and lets us know when the snow is coming in. And so she's kind of our early weather warning system, but she's also, I've known Peggy for probably 20 years or more. She's one of the nicest people you will ever meet in the brain injury community. And there's a lot of really nice people, and she's one of the smartest as well. Peggy's been building very methodically for the last 5-10 years, the capacity for BIA Nebraska to reach out to individual people and provide the services and supports that some of the other states have been able to do through the program of resource facilitation. And so there are programs that do resource facilitation and have done it well for 15 years. And then there are programs that are just in the startup phase, and USBIA has the ability to share with you the full arc of what that might look like. So be aware that Peggy's building a program right now, and she's also graciously taken the reins of our communications committee and she's destined, unless we impeach her once, not even at all. We'll never do that to Peggy. She's destined to be the next chair of USBIA. She's the vice chair currently, and unless she chooses not to, it's likely that the board will ask her to step into that role at the end of this year. So Peggy, this has been, from where I sit, one of the most dynamic years for our communication committee. Do you have any comments before I dig into the weeds?
I don't, other than I'm very thankful for a great committee group. We meet, oh gosh, it's probably not quite every month, but probably at least every other month. And really appreciate the partnerships of making what we do happen. And MCC, you guys do amazing work in making us look like we're a little more organized than we sometimes feel. So thank you both for your work.
Thank you, Peggy. You know, there's a really lovely and dynamic interplay between our committee work and in a functional nonprofit. My experience is the real hard work gets done in the committees, and then the kind of the governance crew get to stop and take a look at that, and often get complimented for what happens. And all the good stuff that happens at USBIA really has nothing to do with the executive committee. It has to do with the volunteers at our committee levels. And so if you're on this call and you have any interest in joining at a committee level, you are welcome to show up by talking to any of our committee chairs, by coming to me. We, when we're doing things well, we're weaving people's skills, passions, and abilities into the areas that are going on. So if you find something in communications that doesn't meet your level of, what would I say, perfection. If you're a graphic design person and you see and you look at this and go, that's what they can do, please know we're delighted that this is what we can do right now. If you have the ability to take us to the next level, open arms to you. Over the last year, communications has brought a series of webinars to the state members for you who are on this call, and or anybody in your state to log into in real time when they're live, and or they're archived via the usbia.org location so that people can view them later. We've had calls or webinars that had to deal with pediatric brain injury in children, one of the hardest and more difficult areas to deal with, which is post-traumatic headache after brain injury. Dr. Nathan Zasler is an international expert in that area and provided us a pro bono set of hours from his office on Headache 101. And if that's not something you've seen, and if you do ever have headaches yourself, it doesn't have to be brain injury and headache. Nathan is like the headache whisperer. So check him out on video. There has been one about funding in changing landscapes, which is pretty much the nature of landscapes in a pandemic or post-pandemic area. We're not exactly sure what the funding changes are going to look like. In North Dakota, they've been informed that 50% of their brain injury budget is on the docket for being cut. In Iowa, for example, we've been informed that anything we ask for has to do with COVID. And so we've had to pivot and talk about the evidence that COVID is causing brain injury and that it is going to be a BFD, a big effing deal in the years to come. And if our legislature wants to help divert people from prison, from jail, from homelessness, from going on to Medicaid, from ending up in psychiatric inpatient placements, from being having substance abuse issues, they would probably be better served by investing a lot less money on the front end, which is what they did years ago. And we've shown them the return on investment, as has Minnesota and New Jersey and many other states. This committee has worked really hard. It's led by Peggy, but it's got members from Minnesota, Pat, Arizona, Carrie, and what other states are represented? Some of these names I have to tell you, Peggy, are not familiar to me.
Kristen is from New Jersey.
Excellent, thank you.
Yep. And we just got a new member from Colorado. And of course, you're going to ask me what is her first name, and I'm just drawing a blank, so I'm all embarrassed. Gavin, you could tell me though for sure.
Kayla.
Michaela.
Thank you. I'm so sorry, Michaela.
And if any of you happen to be executive directors and you think, wait a minute, I've got a staff person who would be interested in working at the national level, they might be able to learn from their peers. It wouldn't take more than 1 or 2 hours a month of their time, and it might bring them professional development. Talk to not to Gavin, talk to the committee chairs, give me a shout, and we'll help move some things along and connect the dots. The other big piece with communications that you may or may not have seen that came out just recently is the earliest release ever, Peggy, that I've seen for Brain Injury Awareness Month. Can you just talk a little bit about what that looks like and how that dovetails with, potential policy change?
Yeah. So this year, thanks to Pat in Minnesota, who essentially put together our toolkit. I don't get to take credit for that either. She put a lot of work into it. And it's essentially what we're wanting to do is kind of celebrate how the resiliency beyond COVID. And because we know COVID's going to continue to be a conversation, but, even after brain injury, during as you've had a brain injury, how did you continue to be resilient given the COVID situation through isolation or things that you tried differently? So it really is, the toolkit is out there already for folks to use. We've created a hashtag. We got some stuff that's going to be available for you to use on your website, as far as Facebook posts and some Twitter feeds. So do take a look at that communications or that toolkit, and hopefully it will be of help to you. So the idea is really so that we're all kind of saying the same thing and really pushing out the same messaging. So please take a look at that. Pat, is there anything you'd like to add to that, since you're the one who did the most of the work on that?
I just want to add how it kind of came about. I mean, so we're in the midst of a pandemic, interviewing different people for Mind Matters magazine. We found out because, people with brain injury have to, take things slower. Their life has changed now, but they felt like the world stopped to catch up with them. And so they were able to work when they didn't think they could work, because they could do, say, Zoom, or they could do, answer the phone and take phone calls from a company. They could take a class online. They couldn't go into college or into a schoolroom or something like that, but they could still they could function at their own capacity, at their own timeline, and at their own level. And finding out from so many people, it just made sense that, people around us that all have brain injury now are feeling that we're catching up with them. The world is catching up as a result of COVID. So to them, it was a positive thing versus a negative thing. So that's what we want to really talk about, is the resiliency of people with brain injury and how COVID really changed things for them in a positive way.
Thank you so much. If you are listening to this live right now and you have a question about, wait a minute, I haven't seen this communications March awareness kit. What? Or if you're listening to this in the future and you can't raise your hand now and ask where the heck it is, you can get a hold of it, and we will share it with just about anybody. I don't know who we wouldn't share it with. Maybe Peggy has 1 or 2 people on the naughty list. No. Okay. So again, if you were to send an email to info@usbia.org, you could connect with us and we could get you that information. There's no wrong door. You go to the website, you find the contact information, and you say, WTF, why didn't I get it? And we apologize that you didn't get it. We don't know. It's either the internet, it's our own lack of organizational capacity, which is not that bad. We're pretty good, but we'll get it to you. And does it mean that you have to follow and do everything in the kit? Hell no. If you even personally, or as a group of people with your book club, sent out 4 or 5 messages to members of Congress, that makes a difference. Don't fool yourselves. The only thing that ever makes a difference with public policy change or changing behavior or perspectives is small groups of people. I think Margaret Mead said something like that, and I've embraced it long ago. So thank you, Peggy, for speaking into communications.
And I want to do a little shout out. We are a fun group. So if anyone wants to join our committee, we welcome all. And what we kind of laughed about the other day, Jeff, you weren't on this call, and I don't think Carrie was either, but almost everybody that was on the call had somebody either in their life or they themselves were getting married. So that doesn't have to be a theme, but if you do have that as a theme in your life right now, we have lots of girl chat about it, but we welcome boys too, so.
Well, and just as a sidebar, there was a season when the committee I worked on, we all talked, and it was a number of us who were all dudes, and we either had been or were going through divorces. So there's the whole arc of what can happen, and we were supportive of each other in going through that process in the most loving, open-hearted way possible. And we had a couple of people who were just pissed off. And every time we met, we'd stop and say, hey, you know, that's probably not going to help you. And so there, you know, we do have these groups. They are mixed gender, they're mixed perspective, they have mixed degrees of experience in life. And it sure as heck won't hurt you if in this time of pandemic, when you probably had less high quality communication than you need, join a USBIA group and become enlightened. Okay, no, that's probably not really an expectation to have, but so our membership committee is led by David King, from the executive director in Minnesota. David is out and off for the week, so I'm going to give him a shout out. David's goal is to strengthen a relationship between the national organization and its members. I can tell you that involves discussing with many states the benefits of being and the costs of being a member of USBIA. The costs are modest. I can tell you that we set that up so that they were modest. The benefits are significant and growing. My feeling of the benefits, and I'm just going to put this plug in for David, is that David and that group are able to connect people who find a place that they might be stuck or that they hope they don't have to recreate the wheel in, and link to another state, another person, another organization that may be out ahead of them, having made mistakes, and learn from them to try to pave the way, and so that you can follow a path as opposed to pave your own. That doesn't mean that some of the people on this call are like, I want to pave my own path. That's great. Go do your own thing, but share it with us so that the people who might be coming behind you might be able to learn from your successes and yours. So that's what we're doing, is trying to reduce the time it takes to deploy programming, information, prevention, research, education, support to people with brain injury and their families. The pandemic has had some challenges on state revenue, but we shouldn't gloss over that. Many of our states have had a reduction. I know our state has. The events that were significant that brought us funding at the state level, some of them were canceled. Some of them went virtual, and it turns out that people don't want to pay full price to sit in a screen like we're doing right now. If I can have coffee with Peggy and catch up interpersonally, that's functionally worth more to me, and it's actually more pleasant. Not that sitting on the phone with you, Peggy, isn't pleasant, but if I had a choice, I'd be sitting with you. So we've noticed that we've had to pivot in a couple of ways. We've had a couple of our states have, frankly, near catastrophic change in terms of leadership or funding. And a number of us, many of us on the USBIA leadership team have spent countless hours with state leaders talking about the pros and cons of either staying incorporated, which was one of the questions that came up, about merging with somebody else, or about staying the course. And at this point, all those conversations that we've had have led to people staying the course to be standalone brain injury alliances. And David and his team, I'm on that team. What we want to do is talk about, and with those organizations, about what are the logistics of staying a viable and healthy nonprofit, and getting to the point where you can respond to the calls of people coming in, that you can collaborate, that you can have somebody on deck, maybe even paid as opposed to all volunteers. And so those of you who are volunteers, my hat is off to you. Alina, I know you're on the call. God love you, because I know that you're carrying so many parts in your state. We have additional states looking to join USBIA every year, and I hope by this time next year to report that we've had 2 additional states join us. Let me just talk a little bit here about Brain Injury Awareness Month. Looks like it would be next on the screen, on my screen. I'm looking at your screen, Colleen, and it's not showing exactly what I have. Maybe I've got an older version. So I'm going to go to this little box to thank. This is the place where, to really thank the committee chairs, the members, the volunteers. You have done so much with your perseverance, creativity, flexibility, baling wire, and grit, and are just go above and beyond. I just am so grateful. This next piece is that future point. The executive committee intends to build on lessons learned that we've developed emerging organizational strengths. We want to build on those. We want to recognize that our national and global landscape has changed in many ways because of the pandemic. That are opportunities, some are threats. And we want to build on a strategic plan. And I know Barbara Geiger-Parker was on the call. Are you still here, Barbara? You're on mute. Well, Barbara was on the call. I saw her face for a while. Maybe she stepped away for coffee. She was responsible for putting together USBIA's first strategic plan some 5 years ago. Well, as we all do, you do a strategic plan and life happens. And so right now, my goal, when people ask me what's Iowa's strategic plan, and mine is just to get through 2020. And now it's to get through the first half of 2021 and see what happens as hopefully the landscape changes for the positive once vaccinations hit and we're able to have our support groups come back online and have face-to-face educational events and conferences. But what we're going to do is solicit information from you, each of you, whether you're an alliance member or an association member or a NASHA member, Scott, or just an interested person with brain injury, without. We want information about how you think we can best meet our mission and the values of engaging our communities to do this thing, to prevent brain injury and improve lives with both integrity, excellence, and impact. So stay tuned and there will probably be surveys, but I also believe that we'll be doing town hall meetings, which would be asking 5 to 10 people just to come in and do a round robin on a specific issue. We'll then try to consolidate that information and come up with 3 to 5 big goals for the next, I don't want to go longer than 3 years right now. Things are changing too quickly. So a 3-year strategic plan would be great. And we'll be able to show you outcomes next year with SMART goals, meaning that they will be measurable and we'll be able to have feedback about how we're doing. We may not meet all of them, but we will sure as hell try. Can we go down a little bit on the screen? Colleen, what's down below? There we go. There's BI Awareness Month. Again, the hashtag is TBI Affected Me. We're trying to tell stories of the personal impact of brain injury. We're not trying to have stories be the "oh, woe is me" or "these bad things happened to me," because for many people with brain injury, including my daughter, she is who she is because of her brain injury, and she is perfect just the way she is. She's freaking awesome. I had coffee with her this week, and she looked at me and she said, "I would never have volunteered to go through that." And she said, "And I am so grateful to be who I am and to be grounded in that experience." She said, "I just feel like it makes me a better person." And I can tell you as her father, I love being with her so much more than I did before. All right, no crying on the webinar. Our highlights at a glance, if we can just bring those up and then we'll wrap up here. We had, yay, record attendance for webinars event. webinar events, that could suggest that we had really low turnout in the past. That might be partially true, but now we have a new baseline to shoot for and above. Our programming to our advocate members and survivor and caregiver constituency, forgive me if that's not a word you like to use for yourself, survivor. I've had people in Montana look at me and tell me we are not survivors, we are thrivers. I've had other people say, I'm just John. It's like, so John, if you're out there, we've had some additional programming from state chapters. We've had scholarships for our chapter leaders to attend the NASHA State of the States virtual event. And that means that we pay the registration at USBIA to get people connected to the state head injury administrators, not just from their state, but from other states, and to see what the best practices are so that when they go back home, they can have aspirations that are built on evidence, on best practices, on promising practices. And so we don't have to make this stuff up as we go anymore. We did the driest thing since making burnt toast. We updated our bylaws. And so Al Sugarman, Bob Carroll on our governance committee took the lead on that. It turned out that it made a difference because we have more flexibility in bringing anybody onto our committees. They don't have to be designated as USBIA members. Again, the awareness campaign, Carrie led the charge on Capitol Hill last year for a BI Awareness Month. We've been exhibiting and maintaining connections with a range of national and international brain injury organizations, the North American Brain Injury Society, the International Brain Injury IBIA Association. We partner regularly with NASHA on public policy and logistical issues. NASHA is the National Association of State Head Injury Administrators. We are on regular calls quarterly with the Department of Health and Human Services Administration on community living, which is the hub for the Federal Traumatic Brain Injury Grant Program. And so we're able to hear and give feedback based on our members' experiences about how perhaps to change the next season of grants to make them more accessible or have emphases that are open to our USBIA members. CDC, Centers for Disease Control and Prevention, have a organizing call. USBIA is invited to the table to learn and listen about where they're going and to give them feedback. So again, our engagement on the national level, our visibility, our capacity, and our clout continue to increase. I believe we had Dr. Michael Hall with a session on the emerging evidence of COVID-19 and how that might impact people, well, policymakers at the state and national level, but then also those of us who are doing that first line of phone calls. Somebody calls in and says, I had COVID and now I have this brain fog thing. Is that something that the Brain Injury Alliance in your state does? What we'd like you to do is have a choice. If you don't want to do COVID, that's, there's member state choice. But if you recognize and want to recognize that acquired brain injury is part of what we do, then it's my belief that COVID-19 is something we should learn about as everybody else does, because the long-term services and supports around COVID-19 are going to be hard to get in a post-pandemic environment initially. Social media engagement, we've added stuff to our library. We're doing the stuff. Are we doing enough stuff? Never. When I was a board chair of the Brain Injury Association of Iowa, I would ask the national staff, why aren't we doing A, B, and C? And I was frustrated a great deal of the time that we weren't doing more. I get it now on the flip side. What we need to hear is creative solutions from people for how we can do bigger, better. A couple areas I'm just going to throw out before I wrap up here are that this last year we finalized a framework for support from different entities. Chaz, are you there?
Yes.
Yeah. What did we call that process? I don't want to botch the name, so that we are in. Yeah, go ahead.
Development?
Yeah, development, yes, but in terms of the documentation and the process, it's a way that we can embrace corporate, individual support for the organization. And I'm going to be just forthright here. USBIA has been gun shy of having too much, if any, corporate support in the last few years. We're gun shy because we experienced in many different ways over the last 10 years, the impact of big money. And it doesn't have to be that big on an organization as big as we are, but the impact of big money donations on mission. And what we wanted to do, I believe, and I don't know that we articulated it just like this, but to get grounded in who we are, what our values are, what we can do without big money. And we've done some pretty amazing stuff. And when I say big money, you know, $5,000 for us would be big money. But there are organizations that have much more than that have shown up over the course of history in the brain injury community and either ended up putting organizations like the Brain Injury Alliance in front of the Senate for Senate hearings. That was back in the days of New Mexico. That's long ago. Or perhaps that have had more of a say in what the direction of the mission is. I think we've got our ducks in a row. I think we're resilient enough. And I think we're frankly more in a partnership area that folks like Vicki Harding and her team, who I saw on the call, you know, we're ready to engage you in ways that we can find that are win-win for organizational mission, landscape, and frankly, at the end of the day, helping people with brain injury live well based on how they define that. Not that they're not living well, but live better, and helping caregivers have the knowledge, the resilience, and the ability to provide the supports that sometimes get asked for or demanded being a caregiver of a person with a brain injury. Then lastly, the place that we are emerging into is for the professionals that serve people with brain injury and their families. How do we help them become more resilient, more expert, and frankly, just learn or relearn some skills or knowledge base that they can maybe get somewhere else if they looked, but we like to put it out there so that it's easier to get access to. Strategic planning is coming. We're going to be knocking on your electronic door. We will ask a certain number of people from different constituencies to join us in some town hall meetings. We're not rushing into it, but by the end of 2021, it is our aspiration to have a clearer vision of where to go in the next 3 years. Hopefully over the course of this year, we'll see what the pandemic, we'll see the tail, hopefully a tail end of it, and see what that gives us as opportunities and obstacles. It is now 53 minutes in. Do any of our committee chairs have any comments that they would like to make? Any of our past chairman? I see Mr. Atwood's here. I saw Barbara Geiger Parker was on. I may be missing people because I can't see everybody on the left side or the right side of my screen. I would welcome you to make any comments about where we've been and how full of BS you think I am. Gavin, that was a direct introduction.
It's a family show. I can't go there, Jeff.
Thank you, sir.
No, I think you know, USBIA is now a very legitimate force in the United States, both in Washington, D.C., when it comes to working with federal agencies, as well as the support that we've been able to give to states that, you know, may be experiencing some sort of challenges, and we all know about those. And so it's been a huge honor of mine to be a part of this and to be able to call upon my colleagues within USBIA and ask questions that, you know, only sometimes the directors are really going to be able to know the answer to. So a lot of you have given me advice, as well as I've been able to work with a few other states on sort of trying to get them in a good, stable place. So no, I'm incredibly honored to have been involved. I'm honored to have been one of the, I think the second board chair of this organization. I thank everyone for being here. Jeff, great job. Great overview. Thank you.
Well, thank you, Gavin. Anybody else from committee chair or past president or chairman of the board? I'd welcome your comments before we wrap up. And if not, we'll wrap up.
Hi, this is Barbara. Can you hear me?
Yes. Are you in Hawaii, Barbara?
I am.
I thought so.
And I'm not a very experienced Zoomer, but I just want to thank Jeff and all of the committee chairs and volunteers who've done such a wonderful job with some staff support, but mostly volunteers. You know, they talk about giving busy people projects because they'll get it done. And that's what I think BIA has been doing. And I would agree with Gavin. I'm just so proud to be associated with such a fine organization that is comprised of just wonderful people.
Thank you, Barbara. 2 follow-up comments. Barbara was our founding chairperson of USBIA, retired from being the executive director of the Brain Injury Alliance of New Jersey. And Barbara, I know you're on mute. You just muted yourself, but I think you owe me a cup of coffee at the Kihei Cafe.
Yeah, well, you know, our granddaughter is going to preschool, so I'm not so sure you want to hang out with me.
Fair enough. I've got it going on too. We'll talk at some point.
Okay.
On behalf of,
And as Jeff's boss, this is Janice Miggle from Iowa. I want you to know of the 10, 11 years I've known you, Jeff, anyway, maybe 10, maybe 11, I don't know. Long time. All I can say is this man eats, sleeps, and drinks brain injury. And it's been a pleasure to know him. It's an honor and a pleasure to serve. But let me tell you, you couldn't get a better board chair as Geoff Lauer. He is just a wonderful, wonderful human being and has done a wonderful job with BIA Iowa. And I guess I'm probably saying he's getting an evaluation soon, so maybe it's going to be outstanding. We'll see.
Don't go crazy now, Janice.
now, I don't want any feedback to Janice about my evaluation.
What did he say, Gavin? I didn't hear Gavin. What did he say?
Oh, I was just saying, let's not go crazy about Jeff now.
I guess he's won me over. Is this a good con job or is he a good, maybe he's a good marketer and I don't know it, but you know, I'm pretty street smart. I come from the streets of South Boston. I'm not easily fooled.
Thank you for the kind words. Thank you also for taking, when you had a break and you were kicked off the board of the Brain Injury Alliance of Iowa, you immediately pivoted and said, how can I help? And you asked if you could potentially apply to be on the board of USBIA. And so you used your time off to stay connected at the federal level. And then you were recruited after your what would I say, waiting period of being off the board in Iowa, and you were recruited to come back. So that speaks volumes to how people in Iowa see you, Janice. And so without getting into the mutual admiration club, I do a little bit more than just eat and sleep and drink brain injury. But I try to stay grounded in this programming. It is, as you all know, a group of people who are dynamic, brilliant, committed, and incredibly kind and sharing. And so when we're doing our job well, we're connecting you, for example, to Dr. Fong in Utah for her skill set of being able to unpack the 101, the biology, the psychosociality of COVID-19 on brain injury. And I just sing in Alina's praises because not everybody knows that we have an expert in the USBIA community on COVID, and she gets asked a lot. And she's also, I believe, got a she's recorded some of her presentations so that those of us who want to get access to that information don't have to chase her down, don't have to break into her day, and can find that elsewhere. So these kinds of offerings that we get from the professional level, from the family level, from the individual level, and from each other, that's what this organization for me has about, and that's what will maintain it. And And that's where we're at. So we're gonna post this document. We're now at the top of the hour. That's been 1 hour. We're gonna wrap up today. We're gonna thank you very much, both those who attended in person and for those of you who are attending in the future. For those now, you can find this and share it with other board members or staff at usbia.org in the next couple of days. We'll have it loaded up. If you can't find it, again, email info@usbia.org and you will get a response within, 10 minutes. No, I'm sorry, within a day. It's an honor. And so we'll look forward to next year, reviewing the year. We'll communicate with you many times between now and then. And we welcome that if you have a question or a concern, reach out to us. We've got enough players on the bench that are really good that we can have somebody get back to you relatively quickly and help brainstorm with you at many different levels for what might be of interest or a challenge to you. Again, Geoffrey Lauer, I serve as chair, stand on the shoulders of giants who've come before me with the United States Brain Injury Alliance. And thank you for joining our first inaugural session of the year in review. You can hit stop on the record button, Colleen.
Thank you.
All right. And for all of you, have a terrific day. Feel free to email me or anybody else that's talked here